Good evening, Dr. Andrew Merrill here at Nightlight Chiropractic, and it's Wednesday night, and you're there, and I'm here, which means that it is time for Wednesday Night Wellness Live. And with me this evening, I have Mr. Kevin Cajun, good friend of mine who has agreed to come out and chat with us for a little bit. And tonight we're talking about a really interesting topic, I think one that we use here in the office quite a bit. But before we jump into that, I wanted to introduce Kevin a little bit. So, Kevin has 20 years experience as a clinical psychologist, working with entrepreneurs, small business owners, professional athletes, helping them to overcome rate-limiting beliefs and negative thoughts to get to a higher level in their business or their sporting career. And so tonight he's agreed to come out and we're going to chat a little bit about something called the biopsychosocial model of health or of treating disease, treating wellness. And it's kind of an idea that was introduced back in 1977. And when it came out, it was kind of hailed as a great new model so that we could help more patients, kind of not fitting them into shoeboxes with their diseases or illnesses, but as something that we could really correlate the psychological aspect and the social aspect and the physical aspect. And so here at Nightlight, we deal mostly with the physical aspect. So we wanted to talk tonight about the psychological aspect and maybe the social aspect a little bit with somebody who has walked that walk and talked that talk. So, Kevin, tell me a little bit. I mean, do you have experience with this biopsychosocial model?
Yeah, definitely. And thank you for having me here tonight,
Absolutely.
Andrew, to start things off. But yeah, having done this for many years now with different realms of folks, starting with athletes, obviously, as you can imagine, over time, the athlete's body wears down. So that's where my experience started, just with pain, be it chronic pain or pain as related to an injury. But it also relates to, as I'm sure you folks can understand, just activities of daily living, right? Anyone past the age of 30 is probably dealing with some level of chronic pain, at least in my experience. Again, level of intensity varying from just kind of annoyance to potentially debilitating. So I've come across that indirectly, never worked, straight as like pain management per se, but I've come across that issue where it may start as a physical issue, it may not always, and we can talk about that if we have time, but it may start as a physical issue, but then it is almost always exacerbated, increased, given the individual's view of life, how they're talking to themselves, and then the environment that they're interacting in. So there's a lot of aspects involved, and that's where the biopsychosocial comes from, right? It's biology, it's the physical, the psycho, meaning the mental, so to speak, and then social, the environment. They're all factoring in together, and what we've seen over the years since the late 70s is that they don't function mutually exclusively, right? You don't just have physical pain and there's no impact on your mental well-being or even the environment and the way you're interacting with your family members, your coworkers, or whatnot, right? Everything is impacting the other variables kind of in a cyclical manner. Well, so it's where you jump into and intervene that matters often.
And I wanted to bring that up because I looked a little bit, and there's some criticisms of this back from the 70s, and even now today, that it's hard to figure out where one ends and next begins, right? It's hard to figure out where subjective pain, something that somebody's really feeling, ends, and where it becomes something that's truly psychological or something that they have incorporated into a part of their persona. So, like I said before, we work here mostly on the physical side, but it's hard to figure out where that ends and where we should maybe find other ways or other avenues for somebody to get help. What's your thought on that? I mean, the two integrate very, very nicely together. Is it something that we should look at early on in a patient's care, or really only when we hit a wall and are not getting the results we're looking for?
I think my perspective from the psychological standpoint, so potentially fairly biased, is that it's the old argument about the mind-body connection, right? Way back when it was the mind and body are exclusive, right? Mind functions over here, body functions over here, and they kind of function independently. Over time now we've seen that they don't. They're related. The body's informing the mind's informing the body, right? It can be chicken and the egg, which is leading which at any given time. But to answer your question, I would state that there needs to be some form of, not mental health full evaluation, but get an idea. I work a lot with people and just listening to their words, how they're presenting themselves. What way are they talking? What words are they using? How intense are those words? And that's going to give me a good idea of, are they describing their environment sort of negatively or positively? Is there hope in this person, or are they kind of looking down? What's their perspective coming in the door?
So if I hear self-talk that is kind of defeatist, that is very, very negative, very, I can never get better, can you ever fix me, doc? I've had this forever. That's the kind of thing that I should identify early. And then maybe patients out there, maybe potential, somebody who's dealing with this should also be looking out for when you hear your friend or family member, maybe you yourself have said, I'm never going to get better. Understand that that's getting in the way of you ever getting better, right? Like that's how that works is if you don't think that you can get well, believe it or not, this like biopsychosocial model would tell you, you probably can't get well. It's going to get in the way of you getting well.
And let's hit on that for a second because I think people hear that and they think, okay, so it's the positive, the power of positive thinking, right? Okay, I've heard this 100 times.
Mind over matter.
I watch Dr. Phil. I've heard it on all the TV. Right, mind over matter. That's true. Now that part is true, but you've got to understand why it's mind over matter and what's going on, right? So your brain is very suggestive, right? It's the most complex organism ever created, right? Is an individual's brain, but it's also very suggestive. And what that means is, and this is why I focus on what people are saying in their words, because what your brain hears, and if it's hearing it over and over again, even if it starts out as a lie, I tell people your greatest lie, if you say it over and over again, will become truth to your brain. And what I mean by that is, if you're saying over and over again, my back is killing me. Oh, doc, my back is killing me. Oh, mom, my back is killing me. Well, it's going to be killing you, right? Because your brain does what it's told. And I can illustrate that really quickly here, how suggestive your brain is, right? I'm going to explain it in a second. But before I do, whatever I say in a moment, what I don't want you to do is think about a white bear. So whatever I say, just don't think about a white bear.
It's impossible.
Exactly. That's how suggestive your brain is, right? It didn't take the command don't, it just heard white bear. So if you're saying pain, I'm suffering, or I'm just looking at things negatively, and you're having that conversation with yourself and with others, your brain is always listening. And the more your brain hears something, it takes it to be true. And your brain wants to obey you. So if you're saying that over and over again, it's going to take it as fact in your life.
Is anybody out there still thinking about a white bear? Because I cannot stop thinking about a white bear right now. I'm focused. I'm just stuck on this white bear. So this is biopsychosocial model. So wait a minute. So you get stuck on this suggestive idea, right? Your brain gets stuck on it. So what do you do? How do you stop that? How do you get past that? How do you potentially combat that without intervention, right? So I'm always looking for my patients. I always want to find them the best solution that they don't have to see a provider for, right? You got other things to do. You got better places to spend your dollars. What's something that somebody could do that really might help them get out of that? Forget the white bear.
So there's two things. The first is just quick education, right? So they've got to, what most people don't understand is how their brain works and the impact it has on their body, right? And we're not going to go into a whole neuropsychology class here. It's just very simple, right? The brain is binary. And what I mean by that is when it's doing things, it can either be releasing good chemicals or bad chemicals for the rest of your body. It cannot be releasing them both at the same time. So in moment to moment in our lives, we cannot feel good and bad at the same time, right? In one moment we can feel good and then something happens or we perceive something happening and we can feel bad the next moment. But at the same time, we cannot feel good and bad. Now, when you're telling yourself a negative story or negative things, or you're portraying or perceiving the world as negative, what it's doing is impacting or increasing the part of your brain that releases negative chemicals. And that then increases the part of your nervous system called the sympathetic nervous system that releases more negative chemicals, the stress hormones, if you've heard about those things, right? As that's getting increased, that makes you more sensitive to your pain. Now, it's more complex than that, and I may have lost some people already with some of the science terms there, but that begins a loop then. The negative thinking releases the negative chemicals, increases the negative sort of part of your nervous system, the protective part of your nervous system, which then increases your ability or your sensitivity to whatever pain you're experiencing.
Let me simplify just a little bit, and this is the way that I learned it, and maybe this jives, but the same pathways that push pain push depression. Right? So the same negative, whatever you want to call it, the same neural channels, the same things run on the same wires, pain and depression go hand in hand. So when you're talking about these negative chemicals, I learned it more as the neurology, like a hard wiring of certain parts of your brain and the certain channels. But I guess, you could talk about it as the chemicals are released in the sympathetic nervous system as a whole. But I don't know if it does it justice because a person couldn't really separate those two, right? Like that experience when you're inside your head, it's hard to separate out. I mean, it's impossible to separate out what's what part of my pain is depression, and then what part of my pain is just truly pain.
I don't know, and that's where I think we can debate a little. Is that necessary to separate it out, or is it just necessary to know that they're interacting?
Fair
right?
enough, exactly.
And the more I'm going at this with a doubtful belief system, with negative talk about it, and really kind of suffering and turning internal, becoming somewhat self-centered about my pain, the worse it's going to get, or the more chronic it's going to be, and it's actually helping to enhance the potential debilitation of it.
Sure.
Now, on the flip side, right, if we can start to talk about hope, right, or just positive coping thoughts, right? Now, easier said than done, but you start out with just understanding that if I start to just change my perspective, and that's work, you've got to make a conscious effort to change your perspective, but just that, today I feel a little better, or I'm going to try to move a little more today. That automatically, again, the brain can't be feeling good or bad at the same time. That will start a new pathway, as we're talking here, being activated, and that's actually going to help activate the calming or the healing part of your nervous system.
Absolutely.
Okay? And the more frequently you have those little moments, I'm not talking about going, you're in all this pain and then suddenly I'm asking you for an hour to be blissful. That's not realistic. But just for moment by moment, right? Start to notice when you're going down that negative path, interrupt it, and we can talk about ways to quickly do that, and just have that moment of hope, that moment of just a positive self-statement, right? Knowing now that it's going to activate that calming, healing part of your nervous system for that moment. And you start to piece together those moments over time through repetition, and that's going to help. Now, is it going to cure if you got a bulging disc or some real physical injury? It's not going to cure anything, but it will help enhance your quality of life and your functioning. And it may help then once you're coming into the doctor's office to be...
It's all part and parcel, right? So we're trying to keep those acute cases from becoming chronic cases. A little bit of faith or trust in the process is important. A little bit of hope, whatever, that you're going to get better, I think is just what you were talking about. Really, really important to the whole process. So I think you mentioned before, I think another trick. I don't know if this was...
Yeah, so as we're talking through pain, and again, over time, never being my central focus, but it coming up, I would say, in 85% of the folks I'm working with, some level of pain. What I've realized is pain is, and I said it earlier, is self-centered, okay? Think about it in a way like that's how it's designed. That's how your body's designed. The pain is designed to alert you and your body that something is wrong, right? So you become internally focused. Then, like, my back hurts, right? I can't move.
But I want to pause you for a second. I don't want anyone to take that as negative, right?
No.
It's not negative. Like, when people hear selfish, they think negative. And I don't want anyone to think that they're negative about the pain that they're experiencing. Selfish is a different term. Selfish, let's just say it's only about you, but not in the negative context like you would insult somebody by saying selfish, just in the context of this is only about you.
Okay, and I shouldn't self-centered maybe wasn't the best choice of words. Yeah. The guy who focuses on words didn't make the best choice of words. Self-focused is probably the better framing of this, right? I'm more internally focused on my pain, on how it's harder to move, on how I don't have as much energy, right? What I can't do. So the quick fix for that, right, is to become less focused on yourself and more focused on someone else, right? On helping someone else. And that has a number of benefits, right? First of all, just social connection. So all you need to do, again, remember, your brain is very directive. It'll take your orders very quickly. So all you need to do is start to ask yourself a simple question when you're interacting with someone or you're entering a situation is, what can I do to help this person or this situation, right? That's it. And now you do it once.
And we're talking about something small, right? We're not talking about like... I'm
not saying volunteering to save the world by any means. I'm just saying, what can I do to help this person, or what can I do to help make this situation better? And it can be as simple. Your brain, again, is going to take the instruction, and it's going to go find the answer. That's its job, is to do what you tell it to do. So if you tell it to hurt, it's going to go figure out how to hurt. If you tell it to figure out how to help this situation, which can be as simple as a smile, again, it doesn't have to be this grandiose thing. It's going to do what you tell it to do. So in those moments, if you're asking it that question, you're directing it somewhere, right? We're all programmed. The question comes at us. We're programmed automatically to answer that question. So ask your brain the question, where you want to direct it. And that will start to, again, it's not you do it once and suddenly you're cured, but you do it once, you get into that routine of focusing on other where you can help them.
Sure.
That's how, again, you get those moments, I call them cause for pause, right? You get yourself out of that autopilot of woe is me, oh my goodness, I hurt, which is all legit pain, I'm not arguing that, but that self-focus, you're taking yourself off of that onto someone else looking to help them. And what that does also takes the focus off you, but it also starts to activate those good chemicals in your brain and that calming, healing part of your nervous system.
And I used the wrong word before earlier too. I said it's almost like a trick, like you're tricking yourself, and that's not, that's probably doing it some big injustice. But realistically, the example that you made before with the white bear, which I still can't get out of my head, I'm still stuck on this white bear.
That might be another issue we need to talk about.
Anyways, so it's the same idea, right? So once you've made the suggestion to yourself, this auto suggestion to your brain, this is what we're going to do. This is how we're going to break the cycle. This is all we're going to do right now. We're not even going to focus on anything else. Just this. You've just, thrown that monkey wrench into your normal pattern of your chronic pain, of your selfishness or your self-centered pain, so that your brain has to do something else. And then breaking that cycle is just like we're doing anatomically, physically here in the office of, repatterning the motions of the body, repatterning the muscle length, repatterning how the joint moves. You're just doing that with your brain, right? So now we've actually identified two pieces of that biopsychosocial model that you can work on, kind of on your own, right? So I would maybe make it akin to do your stretching for your muscles and maybe practice this auto-suggestion, or is that the right word?
Well,
auto-suggestion or just suggestion?
It's not really auto-suggestion. It's an active approach, right? I'll talk about a passive approach when we talk about, in a second, the social part, right? The environment part, what you can do quickly, right? It's an active approach to just get out of your mind. I always joke, I want you to go out of your mind. Right? Because the second you turn the focus from internal to external with the goal of helping, that's the key. How can I help? Right? Because that will start to activate the good chemicals.
That's good.
And that's how it begins, right? That's how it begins.
Well, let's get into that social model. I think you and I, every time we've had a conversation, we really, I focus more on the physical stuff. That's what I do. You focus more on the psychological stuff. That's kind of what your realm is. And then I don't know if we've ever really had a strong conversation about that social stuff. So I'm curious, give me you have a lead in for this? Or do you?
Well, I think here's the issue. The environment is funny because the environment is I call it the mediator, right? In the biopsychosocial model, right? Because you have some degree of control. I can go to a chiropractor if I'm having pain, back pain specifically, and I can some semblance of control over my physical, over the bio. I control my thoughts, whether people accept that or not. We control our own thoughts. So again, I have some semblance of control, pretty much all control, over my thoughts. I might need to train myself and work on some things to get to that point of confidence, but I control that. The social now is that mediating variable because social involves typically other people, right? And we don't have control over other people. But what we do have control over is our immediate environment of how we react to those people and the physical space we want to occupy at any moment. Now, I get the argument a lot of times, what if I come home and I got a lot of kids and I can't get away and I got to cook dinner and I got to do all this other stuff? You can't tell me I have control there. Not in that moment, but you do still have control over how you're reacting to that environment, okay? And at some point, people will always tell me, I have no time to do any of the stuff you're asking me. I guarantee you have time. There's not a soul I've ever met who doesn't have more time than they think they do.
Well,
right?
So you could do this stuff while you're doing other stuff.
And here's how you can start to control your environment. Correct. Simple things again. Simple things. What we're talking about when I talk with people about this or any other behavior change, because that's kind of what we're talking about at a high level here, is changing behavior, changing your thoughts, changing your body's reaction is learning a new language, right? Because we always talk about the mind and body are talking to each other. What are we talking? What are we saying to ourselves? How am I presenting myself to someone else? It's all through language, right? Body language or formal language. So you need to start to learn a new language, right? And that's how you start to shift your environment. And I know I'm out in the weeds now. I'm going to come back.
Hold back.
How you do that is you start to give your brain the new language you want to learn. So the simple way to immerse yourself, right? You want to learn a new language literally, you're going to go to the country. That's the fastest way to learn. You want to learn Spanish, you go to a Spanish-speaking country, right? That would be the most immersive way to do it.
I'm curious where you're going with this.
Here we go. Circling back, now reeling me in. To immerse yourself in your new language now, all you need to do is start to put the new language around you as frequently as possible. And this is where something like the internet or even social media can be helpful, right? So you can start watching YouTube videos or reading blog posts or listening to podcasts that talk about getting stronger or positive mindset or people who came from nothing to be successful. It doesn't have to deal with, I know we're talking here specifically about pain.
You probably don't want to read about that.
It doesn't have to deal with that, and you almost don't want to read about that, right? You want to read about people overcoming, or even I do a lot of just watching comedy on YouTube, a quick 2-minute stand-up routine or something like that.
Or like the old school chicken soup for the whatever, I mean, that's kind of...
The goal with that, but just think about that. You're watching a quick clip here. Everybody thinks it's got to be this long-term big thing I have to do. It isn't. It's repetition that is the key. So if I'm between work, I'm going to the bathroom. If I've got the 4 kids and the dogs and it's 9 o'clock at night, I'll go to the bathroom for 2 minutes, watch the YouTube video on something positive. Again, what is that doing? Getting me out of my head, getting me on something external that's positive, reacting with the positive chemicals in my brain, and suddenly activating the positive part of my nervous system to relax me and heal. In that moment, you may open the door and go right back to the chaos. That's reality.
It's not a one-shot deal.
No, it's repetition.
It takes repetition. It takes learning how to do it and then doing it over and over and over again, as much as you can. Not waiting for that crisis moment. Not waiting for for things to get worse. Just learning it and doing it again and again and again. I like it. We just covered all 3 of those parts. Biopsychosocial. All right, fantastic. Well, is there any place else that you would want to steer them so that they can find more about you, more about this biopsychosocial model, more about some of the techniques that you talked about, maybe?
The best way just to contact me directly at this point. So you can contact me at kevin@profitsoverfears.com. That's email, and I'll reply to within 24 hours is my goal typically. So yeah, kevin@profitsoverfears.com.
Fantastic. Well, that's all we have for this evening. Again, thank you very much for watching this Wednesday Night Wellness Live. We're going to see you next week for a new topic. In the meantime, have a wonderful Wednesday night and a great week.
Thanks, everyone.